Hi, I'm Abigail Leneve. I'm going to be doing my NG insertion today. So first, for the 13 safety practices, you verify the care/order for your client. 2, you gather supplies, perform hand hygiene. You consult manufacturer's instructions. If you are using any equipment, check the facility's policies and procedures, knock on the client's door, then you use 2 patient identifiers, note overall condition of the client, then you explain the procedure, provide for privacy, you elevate the bed for best body mechanics, lower the side rails, don PPE if required. Then when you are done with care, you lower the bed, raise the side rails if indicated in the care plan. And if you have any if there are any abnormal findings, report to the charge nurse. And then the 13th is no IV push without instructor present. And I'm going to, again, do my NG2. So patient is already in semi-Fowler's. And I have to raise my bed for best body mechanics. And we do have an order to place an NG tube. And I've already, of course, identified any allergies. And now I'm going to check my order. So it is 7:30 in the morning. Place NG tube to low intermittent suction for no BM for 8 days. Alright, so I apply my gloves. So first I'm going to verify the serial order for my patient. I'm going to perform hand hygiene after performing any client care or human supplies. I need to verify the facility policy and procedure and send in equipment. You have your tube, and you need to measure. I'm going to knock on the door. And to measure, you will measure from the nose to the tip of the earlobe, and then to the xiphoid process. On them, it'll be about 50, but of course it only goes in so far. And then you would have a cup of water so that way they could drink while you're inserting. And then you coil it in your hand to where it needs to be. This would be lubricated, and then they will take their head back, and then when it's starting to get into their pharynx, that's when they lean forward. And then you ready. And then this is when it would start to lean forward, and they're of course drinking water at the same time. And it's not going to go in all the way, but I need to assess balls onto my patient, and then I'm going to assess the patient in the mirror. I have to plug one side and below, and then switch to the you have to, of course, verify placement, but you also need to make it the nose, to the bottom of the earlobe, to the bottom of the xiphoid process. You also need to stabilize the tube. With tape or note the number. Alright, tube is stabilized, and then hook up to intermittent suction. So of course you would take that out, don't block this, and then hooked up to suction. And there we go. Of course you would raise the side rail, perform hand hygiene, everything, document. And the bed is down, side rails are down. Now I'm back at 10 o'clock for a gastric lavage via NG tube with normal saline 0.9 until contents are clear. And they will be in semi-Fowlers on their left side. But I'm not gonna move them in again. So heavy. Alright, so lavage, we have normal saline. First, you would want to, you would take the instilled amount, normally about 50 cc's, and then you would instill, and then take out, and then you would just keep going until they are clear or there is a light pink, there's no clots, anything like that. And whenever you do place the NG tube, to verify placement, you either use the pH strips or you could use X-ray. But yes, you perform the gastric lavage with the normal saline 0.9% until contents are clear, light pink, but again, no clots. And of course, document. And then I would, of course, lower the bed, raise the side rails again before I leave, hand hygiene and document. And then I'm back at 14:30 to administer Glucerna, 1.5 cal, 100 milliliters with 50 milliliters water flush per NGTQ4 as long as residual is less than 150 milliliters. And before I do the gavage, you need to assess bowel sounds, and then if they have any nausea. But of course, first you need to check the residual, and then like it says, if it is less than 150, then you are okay. So first, you would administer the water flush.
500 milliliters with a 50 milliliter water flush every 4 hours as long as the residual is less than 150 milliliters.
Alright, so you would kink the tube and you would flush first. Then, this is Glucerna, 100 milliliters. So then, of course, kinking the tube so nothing gets in. Then you would instill the 100 milliliters, let it flow. Once it's done flowing, instill the flush, 50 milliliters of water. Make sure it's room temperature so you don't exacerbate any nausea or vomiting. But you would flush, and then afterwards, of course, check the residual and make sure it is less than 150. And then that is the end of the doctor's order. So you would raise the side rail, lower the bed, and document.